Hi everyone, I am Maria Cabuyadao. Today I'm going to explore the future role of mental health nurse in supporting persons with lived experience of mental illness. The integration of examples and exploration of the current mental health nurse practice will be explored later after discussing the future role of a mental health nurse in supporting persons with lived experience. Firstly, how do we define the role of a mental health nurse? The Australian College of Mental Health Nurses defines a mental health nurse as a registered nurse with specialist qualification in mental health practicing holistic and recovery-focused approach guided by evidence. Most full-time employed mental health nurses has reported their primary role as clinician, followed by administrator and educator. In the field of mental health practitioners, mental health nurses is the second most common profession after psychologists. The COVID-19 pandemic is a timely opportunity for mental health nurses to showcase their qualities, skills, and knowledge in supporting people with lived experience as a qualified mental health professional credentialed by Australian College of Mental Health Nurses. COVID-19 pandemic has stressed the importance of futuristic, collaborative, facilitative, and decision-making roles of mental health nurses due to uncertainties during and after the pandemic. Other potential consequences of COVID-19 crisis as an opportunity for mental health nurses in redefining their future role are mental health nurses' involvement in co-production of improving digital health support like telehealth, virtual meetings, and other home-based treatments, mental health nurses' involvement in the co-design of safer environments for both quarantined and non-quarantined people with lived experience while maintaining mental health nurses' safety as a qualified professional, and maintaining adequate delivery of quality health service to address current and future biopsychosocial needs of people with lived experience. Mental health nurses as an ally to lived experience workers has two major roles, namely as a role model in working with lived experience workforce to decrease stigma and as a support to the success of increasing lived experience roles. Mental health nursing practice can be more efficient from increased support to experts by experience. The standards of co-production of education in mental health nursing is formulated in support and strengthening of the Commune Project's recommendation. The Commune Project's involvement of people with lived experience of mental distress improves mental health curriculum and workforce effectiveness and skills. The commune is similar to how my training day started as a mental health nurse trainee. For example, I was asked to participate in the group discussion during my first day at workplace to listen to people with lived experience practitioners, and non-lived experience practitioners. After participating, I was asked to self-evaluate my qualities, fears, and biases to have a better understanding of myself as a person and as a practitioner. The activity taught me to define a recovery-focused approach, ways to improve the service, and ways to decrease stigma expressed by both service users and practitioners. The stepped care indicates how much level of need and what the mental health nurses' focus of care are when fulfilling their various roles in various settings, providing optimum care involving biological, psychological, and social needs of service users. Most of the Australian universities support the widely accepted consumer-led and consumer-focused researches. The partnership in research between the lived experience experts and the mental health nurse specialist leads to the better representation of lived experience views, improvement of the involvement of lived experience roles, and the promotion of recovery focused services to encourage people in using the services. The researches may guide the development of future roles and practice of both mental health nurses and lived experience workforce. In conclusion, the preparation and honing of mental health nurses' qualities required for future role is redefined by current evidence, trends, events, and changes in the Australian society. The mental health nurses' attitudes, knowledge, and qualities towards recovery focused care must be readily available in supporting people with lived experience holistically. Mental health nurses must be ready to set their personal biases aside to deliver authentic and empathetic care.